If you're over 50, your mouth may be showing signs of health problems long before blood tests do. Most people miss them. Even doctors don't always talk about them. Have you ever noticed something unusual in your mouth, a change in how your gums look? Or a persistent taste that wasn't there before and wondered if your body was trying to tell you something? You're not alone. Over the years, I've sat across from thousands of people who mentioned small things they noticed but weren't sure mattered. And here's what I've learned. Your mouth often speaks before the rest of your body raises its voice. I'm a physician who has spent decades listening to people, not just examining them. And one of the most overlooked conversations we have is about what happens in the mouth, not just teeth or gums, but what those changes might quietly reflect about the rest of you. Today, I'll walk you through 5 warning signs. The first 4 are physical patterns I've observed over years of practice. The fifth is something most people never talk about, and it's the one that touches me most deeply. Let me share these with you, one at a time, the way I would if you were sitting here with me in this room. The first thing I want to talk about is persistent dryness in the mouth. Many people assume that as we age, having a dry mouth is just normal. And to some extent, yes, our bodies change. But what I've noticed over time is that persistent dryness, the kind that makes it hard to swallow food comfortably or leaves your tongue feeling rough, can sometimes reflect something happening elsewhere in your body that deserves attention. This can happen for many reasons. Some medications, especially those for blood pressure or mood, can reduce saliva production, but dryness can also appear when the body is managing blood sugar differently or when hydration levels have quietly shifted. It's not always obvious. You might drink water and still feel that sticky, uncomfortable sensation. I remember a woman named Margaret, who was 73 at the time. She came in for a routine visit and mentioned, almost as an afterthought, that her mouth always felt dry. She said she kept water by her bed, but it didn't seem to help much. She thought maybe it was just her age. When we looked a little closer, we found that her blood sugar levels had been creeping up slowly over the past year. Her body had been sending quiet signals, and her mouth was one of them. We didn't panic. We didn't overhaul her entire life. We made small, respectful adjustments to her routine and worked with her other providers. Within a few months, Margaret told me she could taste her morning tea again. That simple pleasure had been gone for so long she'd forgotten it mattered. What I want you to hear is this. Dryness in your mouth doesn't mean something is terribly wrong, but it does mean your body is communicating, and you deserve to understand what it's saying. The second pattern I've observed is changes in the color or texture of your gums. Most of us were taught to brush our teeth and maybe floss if we remember, but we don't often look closely at our gums. And yet the gums can sometimes show us things that are happening deeper inside the body. If your gums seem swollen, or if they bleed more easily than they used to, or if they become pale or unusually dark, it's worth paying attention. These changes can sometimes reflect inflammation that isn't limited to your mouth. Inflammation in the gums has been quietly linked over years of research to patterns in the heart and blood vessels. The same systems that affect one can influence the other. I once spoke with a man named Robert, who was 78. He mentioned that his gums bled when he brushed his teeth. He figured he was brushing too hard. But when we talked more, he also mentioned feeling more tired than usual, and that his legs felt heavy when he walked. We didn't assume anything. We simply looked at the whole picture. It turned out his circulation needed some support, and his body had been showing signs in more places than one. Robert started working with a care team that included his dentist, and over time, both his gum health and his energy improved. He didn't get younger, but he felt more like himself again. Your gums are not separate from the rest of you. They're part of a system. And when they change, it can be worth exploring what else might be shifting. Most people don't connect this to the heart. That's why this one is so often missed. The third thing I want to share is about persistent sores or spots that don't heal. We all get small cuts or irritations in our mouth from time to time. Maybe you bit your cheek or ate something too hot. These usually heal within a week or two. But if you notice a sore, a white patch, or a red area that stays for weeks without improving, that's something to bring up with someone who can take a closer look. Sometimes these spots are related to friction from dentures, or dryness, or even stress. But in some cases, they can reflect changes in the cells of the mouth that deserve early attention. I'm not saying this to alarm you. I'm saying it because early awareness often makes all the difference. I knew a woman named Doris who was 81. she had a small white patch on the inside of her cheek that had been there for over a month. She didn't think much of it. She assumed it would go away. When she finally mentioned it during a checkup, we referred her to a specialist who examined it carefully. It turned out to be something that needed gentle treatment, but because Doris spoke up, it was caught at a stage where care was straightforward. Doris told me later that she almost didn't say anything because she didn't want to seem like she was complaining about something small. But there's no such thing as a complaint when it comes to your own body. You're the expert on what feels different for you. If something in your mouth isn't healing the way it used to, it's okay to ask about it. You're not bothering anyone. You're being wise. Now, if this is resonating with you so far, I'd love to hear from you. If one of these insights has made you think about your own health in a new way, just leave the number of that insight in the comments. It helps me know what matters most to you. The fourth pattern I've seen is changes in taste or a persistent metallic flavor. This next one surprises people the most. Taste is one of those senses we take for granted until it changes. And when it does, it can feel unsettling. Some people notice that food doesn't taste the same anymore, or that there's a strange metallic or bitter flavor that lingers even when they haven't eaten anything. This can happen for several reasons. Medications are a common cause. Many drugs alter taste as a side effect. But changes in taste can also appear when the body is managing vitamins or minerals differently, particularly zinc or vitamin B12. Sometimes it reflects changes in how the stomach or digestive system is working. I remember a gentleman named Leonard who was 75. He told me that everything tasted like metal. He'd stopped enjoying meals, which had always been a highlight of his day. He thought maybe his taste buds were just wearing out with age. When we looked into it, we found that his B12 levels had quietly dropped. It wasn't a dramatic deficiency, but it was enough to affect his sense of taste. We worked on gently bringing those levels back up, and over the next several weeks, Leonard told me that food started tasting like food again. He said it felt like coming back to life in a small but meaningful way. Your sense of taste matters. It's connected to your appetite, your nutrition, and your enjoyment of life. If it changes, that's not something to ignore or accept as inevitable. It's something to explore with kindness and curiosity. And now, the fifth thing I want to share. This one is different. I could talk about another physical symptom, another sign to watch for. But what I've come to understand after all these years of listening to people is that the most important message your mouth might be sending is not about a disease or a deficiency. It's about whether you feel heard. So many people have told me, often with tears in their eyes, that they stopped speaking up about small things because they felt dismissed. They felt like their concerns were brushed aside, or that they were being dramatic, or that getting older meant accepting discomfort as normal. And so they stopped mentioning the dry mouth, the sore that wouldn't heal, the change in taste. They learned to stay quiet. I knew a woman named Eleanor who was 84. She came in one day and said, very softly, that she didn't know if her symptoms mattered anymore. She said she felt like her body was just breaking down and that talking about it wouldn't change anything. We sat together for a long time that day. I told her that her body still mattered, that she still mattered, that every small change she noticed was worth hearing about, not because it would always lead to a dramatic solution, but because she deserved to be listened to. Eleanor started speaking up again, not aggressively, not demanding, just calmly sharing what she noticed. And her quality of life improved, not because of any one treatment, but because she felt like a partner in her own care again. Your voice matters. The things you notice about your body, no matter how small they seem, are not trivial. You are not a burden for bringing them up. You are advocating for yourself, and that is one of the most powerful things you can do. I know that some of what I've shared today might bring up feelings. Maybe relief, maybe sadness, maybe frustration about times you weren't heard. All of those feelings are valid. Take a moment if you need to. This isn't about fear. It's about awareness. It's about reclaiming your voice in conversations about your own health. Here's what I hope you take away from this conversation. Your mouth is not separate from the rest of your body. It's a window. It can reflect patterns in your blood sugar, your circulation, your nutrition, your medication effects. But more than that, it's a reminder that you are still here, still noticing, still capable of making choices that honor your well-being. Aging does not reduce your value. It does not make your observations less important. If anything, the wisdom you carry about your own body, the decades of living in it, knowing it, makes your insights more valuable, not less. If something feels different, it's okay to bring it up with your doctor, your dentist, anyone on your care team. You don't have to have all the answers. You just have to be willing to ask the question. And if you don't feel heard the first time, it's okay to ask again or to seek out someone who will listen with respect. This is a partnership. Your health is not something being done to you. It's something you're part of creating every day. If this conversation has been helpful to you, I'd be grateful if you'd share it with someone who might need to hear it. And if you'd like to stay connected, I invite you to subscribe. I'll continue to share these quiet, important truths in a way that honors your dignity and your experience. Thank you for being here. Thank you for listening. And most of all, thank you for caring enough about yourself to seek understanding. Take good care.